Hi, everyone, and welcome to episode 120 of the Veterinary Behaviour Chat podcast. And we've got such a cool topic today, and I'm joined by one of my very dear friends, the award-winning Dr. Hannah Capon from Canine Arthritis Management in the UK. And I want to talk about this topic today because it's a question that I get asked by both general practice vets, but more than that, by so many allied professionals. And that is, how can I persuade either the pet caregiver or the GP vet to take me seriously when I say that I think I have a suspicion of either chronic pain or discomfort in a pet that I'm working with? And funnily enough, this wonderful, wonderful resource that we're going to be talking about today, I think, Hannah, you designed a while ago, but it wasn't until last year where we had a couple of sort of speaking gigs together, where we spent a little bit of time together, and you presented this document again in some of the talks you did, where all of a sudden I had this light bulb moment, and I thought, it's already here. It already exists. What we need already exists. And so I'd love to, chat about the resource today that's called the Suspicion of Chronic Pain document. And just want to make it absolutely clear that Hannah is the creator, the inventor.
I'm not the creator. It's the people that surround me and influence me that are the creators.
And you put everybody's ideas and everything onto one page, and you designed this amazing resource. So welcome, Hannah. And chat us through how did this come to be? How did it become a thing? How did it come into existence?
So I think because I've got no formal kind of like training in any of the disciplines that surround chronic pain, be it behaviour, be it orthopedics, be it internal medicine, be it nutrition, I'm kind of like this jack of all trades that sits in the middle as like a telephonist, kind of listening to all these different parties. And I think that puts me in a bit of a different position where I get to tap into different resources and thoughts and stuff. And when I got interested in arthritis, I really, really didn't know what I was doing. Like, let's be really honest about this. And in many ways, that's kind of a good place to be, because you always then see it from the perspective of the people that you serve. I think if you've been on a long education journey, you can become very swayed by the information that surrounds you, and that their level of knowledge and their level of language that they use to convey these topics. So by being telephonist, jack of all trades, servicing the audience, I think I was able to create a penguin book tool that came very naturally to me, but other people probably would have had a fight with it because it's too simplistic. It doesn't convey the real complexity of the chronic pain experience and the mechanisms that underpin it. I think if I try to write that tool now with what I know now, it would look like a spider's web. Let's be really honest. You know, when you start accruing knowledge, you find it really hard to pull it back to simplicity. But I think one of the things that's good about this tool is that it is so simplistic. And it got created after I'd been at a conference and I just kind of launched CAM, and people were beginning to hear about it. And these two beautiful groomers beelined me, and they were like, "We've got a problem. We see what people are talking about. We see the posture changes. We see the behavior changes. We see the physical changes. And we say to our caregivers, there's something not right here. We really need you to go back and get it checked by your vet." And they go back to the vet, and the vet doesn't see it, doesn't experience what we've experienced. Caregiver loses faith, money's exchanged, it hasn't gone anywhere, they've been inconvenienced, vet says there's nothing wrong, they lose faith in me. We need something. And I kind of went away going, okay, how do we create a very simple piece of material that can be scribbled on in the busyness of a grooming salon or in the busyness of a consult room, that can be taken away, or it can be used as that kind of messenger pigeon? And it kind of came from there, really. It has to be simple, and it has to be something that you can look at really quickly and go, I get where you're coming from. And that was the design. It was like, keep the domains really simple. Let's not make it more complicated. Let's present it in a way that somebody that's got literally 15 minutes with that client can look, and it can prompt their cognitive processing of, oh yeah, behavior, oh yeah, oh right, yeah, you're right, a possibility could be pain. It's not definitively, but it could be. And so simple.
So how many years ago did you create it? So it must have been, what, 10 years ago?
Yeah, well, probably about 8 years. I think it would probably have been, I think it came after the home fast tool. I think that was the first brave move I made, which I love. I love it. The home fast tool is also called It's My Home Too tool, which I find so emotionally powerful. We ask them to live in our world. Do we actually ask them, are they enjoying living in our world? Are they comfortable in our world? And then why should we be surprised if they're not comfortable in our world, if they don't behave how we want them to behave in our world? You know, come on. It makes sense when you put it like that, doesn't it?
Yeah, absolutely. All right. So 8 years old, and I can't believe I only really got it last year. So chat us through the 4 domains that are in there. So you just mentioned them sort of briefly, but yeah, what are the 4 domains and how is it intended to be used? Like if somebody had it on their consult room table, what would they be looking at and what would they be scribbling down?
Okay, so I have to just check because there is slightly 2 versions of it that I've formed over the years. So the one that we use currently is behavior change, postural changes, physical changes, capability and gait changes.
Yeah, exactly.
Yeah. So basically, from me and my perspective, you know, I know that you can put motor responses, so gait and stuff, into behavior, but I feel for the audience that I speak to, we need to separate them. Behavior to the audience that we teach is their mood, it is their choice of responses to all manner of interactions, not just mobility. But I know theoretically they should be merged together. That is, a motor response is a behavioral response. So we've pulled them apart. Behavior is often the first indicator that something's not right because it takes time for the other things to appear. The physical changes, the postural changes, the capability and gait changes. So behavior sits at the top. And I think we should start being more confident interpreting our pets' moods, their choices. So that sits at the top. And then next to it are 3 dots, 3 lines of dots. So people get to describe their observations. So it might be, he doesn't greet me at the front door anymore. He's not interested in play. He's started being, anxious around other dogs. Brilliant. Fill it in. You can carry on if you want to keep going into the sides, whatever you want to do, but 3. And then at the side, we've then got our postural changes. So in my mind, if something's uncomfortable, the first kind of indicator is that protective stance. You take on a posture that is more comfortable for you. So if you've got abdominal pain, you might rotate your back. If you've got shoulder pain, you might offload. But they're not hard and fast. They could be transient at that point. So for me, in my simplistic mind, that kind of came second approach. So that's there over on the right. Again, 3 dots, 3 lines of dots. Then underneath, we've got the physical changes and the capability and gait changes. Capability and gait changes, if you've got postural adaptations, if you've got kind of anxiety-driven decision-making, your movement patterns are going to change. The way that you attempt to get on the sofa, to get onto the bed, do the stairs, how you lay, how you sit, how you sleep, how you walk are going to be influenced. So that's in our capability and gait. And then underneath, we've got our physical changes, because over time, physical changes take place, and it might be muscle mass gain, muscle mass loss, coat changes, wear and tear on the pads. So I felt that I was covering what I would be able to interpret in a clinic situation. So if I was in a consult room, and bear in mind, one of the key drivers of this tool was to be able to allow the paraprofessionals, allo professionals and the caregivers talk to the vet, who is legally the person that does diagnosis and prescription. So one of the really important things about the tool for me was, would I be able to read it and process it in the nature of a 15-minute consult? And I wanted it to be in a way that I could go, right, yeah, get you. Yeah. And it wouldn't mean that I'd spend 10 minutes of that consult where the caregiver going, well, last Friday he was going up the steps and another dog, and then a pigeon flew down and the dustbin man arrived and he was a little bit uncomfortable. And you're like, Where are we going with this? So I wanted it to be a brief, short, sharp talk.
Yeah. And for anybody that's watching this, I just had a coughing fit. I have lurgy, so my apologies. But yeah, I mean, and that's the thing, isn't it? It's such a wonderful tool. And one of the things I remember that you said when you spoke about it is that it really increased your confidence when you were looking at the animal, because all of a sudden you had these 4 areas or 5 areas that you were looking at. And all of a sudden your confidence increased because it actually made sense that what you were seeing was potentially something that could be linked to pain.
Yeah, definitely. I'll explain that. So I use it as a teaching tool when we do practice trainings and stuff. Because when you start out getting interested in pain, it's really overwhelming. It's like, I've just been to Italy. I was just saying to Katrin, hanging out with Larry Davis and Giulio Spatini. Oh my God, I know nothing. I know nothing now. It's panic stations, because pain is just such a massive topic that it encroaches into every other domain of learning. You can't be interested in pain without understanding a bit of nutrition, orthopedics, internal medicine, behavior, rehab. It just can't. It doesn't exist without creeping into all these different disciplines. So when you get interested in pain, you start realizing how pain is expressed. It's quite overwhelming to sift kind of through the chaff, if that makes sense. And I can remember 10 years ago when I was becoming interested, I was also in a position of responsibility where I had to have a strong enough case to make a decision that had benefits and risks. So Labrador comes in, there may be a little bit of a gait disturbance, maybe we've got some muscle mass changes, maybe I hear about his mood being low and he's not engaging as much. Oh, is that data strong enough for me to suggest bringing in an intervention or suggesting doing further imaging, etc.? So for me, I also had a lot of my colleagues, no offense to the vet profession, but they weren't on the same journey as me. So for me to justify my intervention, it wasn't just with the caregiver, it was also with my colleagues of why did I have this dog in for further imaging? Why was I going to prescribe it? And I also had to put in my notes, because if that caregiver didn't see me second time round, how awful would it be if they saw my colleague who didn't see what I saw? So I needed to kind of have this confidence in my own capabilities, and the tool really served that. So initially I would be looking to have input in 3 of the 4 domains: a bit of behavior, a bit of a physical, a bit of a postural change. And I'd be like, yeah, say something. And now, understanding pain a lot better, still tip of the iceberg, I feel that I can talk about it being a potential, even if just one domain is being mentioned.
Yeah. And I think the other thing that you just mentioned there, which is so, so important, is that vets love data. And it's that whole thing, exactly like you said, not having to listen to the whole story of, he did this last Friday when I went fishing or whatever, but actually having it clearly written out in a way that a vet can look at and can kind of assimilate that information and make sense of it and really think, okay, yeah, we've got something here and it's worth further investigating, whatever it might be. So I think that data piece is such an important one. So I think the data, together with, like you say, the confidence and the being able to clearly show, I think those are things that are just so, so valuable. And that's why I think this is such a fantastic tool for allied professionals, like you say, groomers, right? It came from that, and they spend so much more time with the animals, observing them, feeling them, feeling different sort of tension throughout their bodies and all that sort of thing, how they stand up, how they sit down, where they like being touched, where they don't. So, and we as vets in a 15-minute consult, or GP vets, don't have the benefit of that.
We do not. And I think we've got to be more able to talk about the limitations of the standard system that we have, because we do expect a lot of ourselves, and our caregiving population expect a lot of us in such a very small time. And I can remember, like, when I first met Sarah Heath, she terrified me. Oh, I'm so scared of Sarah Heath. And now I'm happy to say that she's a dear friend. I love Sarah Heath. But right at the beginning, she did a little video for Cam saying that it's impossible to diagnose chronic pain in a consult room, and I will remember it so clearly because it made me feel so much better with how I was feeling about what I was struggling with. So to have somebody as powerful and knowledgeable and experienced as her say, no, it's impossible. And I was like, oh, thank God, thanks, Sarah. Thanks, Sarah.
Yeah, no, that's absolutely brilliant. Anything else you want to tell us about how you would like to see the document used? I mean, ideally, we'd like to kind of see it in every consult room, across the world, not just veterinary consult rooms, but non-veterinary behavior consult rooms, grooming rooms. How do you see it being used?
So this is really interesting, actually, because there's a real drive. It's like there's a big race going on at the moment to get digital kind of AI technology to identify pain. And I would say that everybody's very focusing on lameness. So using video technology to look at like kinematics and see whether we can use AI technology to identify lameness. We've got a real push with the kind of electronic digital tool questionnaire-based products. I see that we've got an amazing way to detect pain in a very simple, easy to use manner right there and then. So for me, I'd love the tool to feature in, as you say, like a use it now. It's available. Let's start using it as a screening tool. There are screening tools. Now, don't get me wrong, Duncan, I don't want to upset you about your 6-question questionnaire. It's fantastic because we have got these screening tools that are being scientifically validated. But some people don't respond to that. The 6 yes or no questions, the FMPI, blah, 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 blah. There's something quite beautifully simplistic, Penguin book about this, isn't it? Penguin book, by the way, guys, are those little kids books that are really easy to read. You can read one in like 3.5 minutes.
I love a Penguin book.
I love a penguin book, and there's something quite beautiful about bringing a penguin book. We've got to think about the client experience, haven't we? And we've got to think about this interdisciplinary team. I'm doing this master's. Oh my God, it's amazing. But over in the human healthcare management of pain, it's unthinkable that it wouldn't be interdisciplinary. It's just set in stone that all aspects of medical care, all different skills and disciplines work together, and we're still not there yet, are we? So we've got to look at tools that are going to enable us to communicate amongst each other well. So I think the suspicion of chronic pain, it'd be lovely if people knew it was available, knew that it was a really good tool that they could use with their clients, knew it was a good tool that they could use to disseminate information to the rest of the team. I use it to then populate what we call the chronic pain indicator chart. So if those are the caregivers' observations, then they should be the observations that we hopefully monitor to see if there's improvement or deterioration. Yeah. So for me, it's like a teaching experience, because I get to say, what do you see? We populate it into domains. Then I explain the mechanisms that underpin why that might feature. So then they're like, oh God, so it's a good indicator. I'm like, yeah, it's a great indicator. Then we use those indicators in our ongoing monitoring tool. He doesn't greet me at the door anymore. Okay. Is he greeting you at the door anymore? Yeah, actually, the other day he got up and he's been consistently coming to see us. Great. So what we're doing is working. So I see it as a screening tool, a teaching tool, and a blend into a monitoring tool.
Okay, love that. I think one thing that you said there is really important, just to mention it and to say that it's not a validated tool, right? It is to be used in a clinical setting as part of your kind of like clinical toolkit, exactly how you've just mentioned. But yeah, it's not validated. So just for everybody listening to make sure that everyone knows that. And I actually have it right here. So for anybody that's watching this on video, this is exactly what it looks like. So you can see the kind of 4 domains there, exactly as Hannah mentioned, the behavior sitting at the top, and then the other 3 kind of around the corner there. And that's exactly the boxes that you would fill in. So that is your suspicion of chronic pain document for anybody that hasn't actually seen it or that's interested to know how it looks. And where can people find it, Hannah? If people want to actually use it, where can they get their hands on it?
So Canine Arthritis Management has a member zone. The member zone has all of our resources. So You can find the recently diagnosed kit, how to introduce a ramp, the importance of nail care, acute flare documents, nurse flip chart, kennel tags, you name it, it's in the member zone. So if you go to caninearthritis.co.uk, if you become a member, which is a mere £35 for the year, you can tap into all of these resources so you can bring it into your clinical practice.
Brilliant. And we will absolutely put that link into the show notes so that people can get there really easily. And you can also find the Suspicion of Chronic Pain document in our professional guides ebook, because Hannah very kindly allowed me to co-brand the document with CAM. So there is a co-branded Trinity and CAM version of it. And you can find that in the professional e-guides, I can't say it today, in the professional guides ebook, which is an ebook is 48 pages long, has got 13 resources in it. So I'll put the link to that in the show notes as well. So that's another place you can find it. So there's a couple of different places, and you can just print it out, download it, have it as a poster on your wall. A really good, like you say, teaching tool that, you can also kind of chat to caregivers about all the things that you're looking at or what you're potentially looking at. So yeah, we will put all the places there and make sure.
I'm just going to say something. Yeah, I'm just going to say something else because me and you have both been on like a little bit of a marketing journey, a bit about brand values, brand awareness and stuff. And this sounds really kind of a little bit stickler, what I'm going to say, but it makes a lot of sense. So when I started CAM, I had this kind of branding experience where I was taught the importance of consistency, colour scheme, fonting, having that personality that's consistent to build trust, reliability. People can focus and go, oh, I'm comfortable there. I feel safe in that company's presence. And think about it. It affects us with the food that we buy, the clothes that we buy, the shoes that we buy, the cars that we buy. There's that familiarity, isn't there? So then you trust it. So I have noticed a lot of people that are taking tools and then rebranding them under their own brand, which is fine. You can understand people wanting to create their own brand. But one of the things that does stop is that person feeling confident with the rest of that brand's resources. And one of the things that we were really strongly supportive of at the beginning is CAM needs to be a familiar place where people feel safe for a long period of time, because arthritis isn't a quick transient diagnosis. It's a lifetime chronic disease. And I wanted people to get that brand familiarity, can't say the word, and feel safe. So just when you're thinking about using the tool, I'm not being a stickler, but just think about the longer term. By you taking the tool and putting it under your branding, you're actually stopping that journey into the other resources and support.
Yeah, very well said. And I think that's a good message for everyone. Yeah.
I sound like such an old fuddy-duddy, but it's kind of it's really fascinating how we are going as a world. We're trying to create pockets of goodness, whereas I believe that we should be sharing our pockets like we've just done with the tool. Yes. I'm really happy that you're using, because it will meet more people, and you've got tools that I'll use in CAM, meet more people. We should be working collectively rather than just trying to individually deal with the issue. It's too big a thing to think you can do it as an individual.
Absolutely. And that's why it was so important for me to, make sure. And if you do download the tool from the Trinity, the Professional Guides ebook, you'll see that it's got CAM all over it. It has CAM's logo there. It's got CAM's flavor. It's got the link on there too. All the other resources that you can get within CAM. So it's definitely a collaborative piece, and we've tried to make it as collaborative as possible, haven't we, to make sure that, I think you're right, that brand recognition and that feeling supported by two brands who kind of have essentially the same goal in mind, to provide, good welfare, healthcare, wellness, well-being, whatever you want to call it, for pets throughout their lives, not just for a snapshot in time.
Exactly.
So, absolutely. All right, we will put all the links in the show notes, and please go out and use the tool. And for anybody that's ever asked me, how do I persuade my vet XYZ? This is how you use a tool like this. You pick up the observations, document them, give the vets the data that they need to be able to act upon. And then hopefully that will kind of also build trust between the vet and you. So, the vets are seeing what you're observing, they're understanding that you know what you're looking at and what you're talking about. So I think that's another really big piece, is your own credibility by observing and documenting some of these things. So I think it's a really great tool for all professionals, whether you're vets, vet nurses, allied professionals, you know who you are, and it's a fabulous tool. So thank you so much, Hannah, for A, allowing me to co-brand it with you, B, for coming on and telling us a little bit how it came into being, and how
by accident, as everything in my life.
As everything, no, exactly. But that's the best way to do it, right? But also how you, as its creator, intend it to be used. I think that's an important piece as well.
Thank you, Amy.
Thank you. And for everyone who's listening, thank you so much for tuning in. And I look forward to chatting to you again next week for episode 121. Bye for now.